The thing that was really interesting was the alcohol consumption.
Uh-huh.
I had no desire to drink, which was really interesting to me.
And you'd think I would have noticed that. But okay. This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I have a very, very special guest today. My best friend, Felicia, is here, and we are going to talk about our experience on the GLP-1s because that has been just wild for both of us,
Yeah.
and it's taking the whole country by storm. And we just watched the Super Bowl, and there were 2 ads for online GLP-1 weight loss programs, and they're basically advertising to the millions. And so we would just wanted to share with you what our experience has been so far. So, Felicia, thank you so much. I'm so glad I got to convince you to come do this with me. Thank you.
Oh, thank you. I'm super excited to share my story and hear, a little bit about what you think with GLP-1s and where we're going with the medicine.
Yeah, well, I mean, as I've mentioned to you before, I really think these drugs are a game changer for so many people, for diabetics, for people who are obese, but also just for those of us who struggle with our weight. And maybe we're postmenopausal and maybe
Right.
we struggled losing that weight like in a way that we didn't used to when we were a little younger.
Yeah.
So let me ask you, let's just
Yeah.
start with you.
Yeah.
Since you've had maybe a little more because I have not tried semaglutide. So
Yeah.
can you just describe where you were before all of this and when you started and what your experience was?
Sure. So I was about, this is menopause, right? And I had about
Yes,
14
welcome to
pounds.
menopause,
Yeah.
everybody.
And I was about, 14 pounds-ish overweight. And from my perspective, right? What felt healthy to me. And which is not overweight at all.
Yes, and just to be clear, I mean, we are both in our 50s, super active, we're
Yeah.
fit, we eat well.
Right.
And maybe similar to a lot of people in the country during COVID, we both, I think, started
Yep.
drinking a little more frequently
yeah.
than we were before COVID. And that was also hard. I found that really hard. Like there's nothing else to do. So you have a glass of wine every day. And
Yep.
before you know it, it's 1 to 2 glasses every day. And before you know it, your belly shows that. But anyway, so
Yeah.
here we are in our 50s and no, so not obese, not even really super overweight, just
No.
for us feeling like, for me, I was about 22 pounds.
Yeah. I was about 14.
Yeah.
And so I continued with my, good eating and my workouts. So that didn't change. But I decided last February that I really wanted to, sort of look into the semaglutide, obviously the compounded version. And so I did a little bit of research on the options and locally where I could go in with a provider.
Right. And so it's been a year.
Correct.
And at that time, I didn't have a program.
You didn't have
at
it.
all.
And I didn't share it with you,
I
actually,
know.
which is why it's great that we're normalizing this, right? So I didn't even share it with you. I didn't actually share it with anybody. I did my own research. I have a little bit. I'm in the healthcare space, but I'm on the business side. So I'm not a clinician, but I know enough to navigate. And so I found a provider who, would compound this from a compounding pharmacy. And I trusted that he would do the right thing and provide the right product. And so I started that and obviously had to titrate because I wasn't at the dose that I needed to lose the weight for a couple months, really. But so, I started the semaglutide and it worked pretty quickly. And the thing that I noticed the most, sort of the side effects were constipation. So my fiber intake increased. And I had a sense of this was the thing that was really interesting was the alcohol consumption.
Uh-huh.
I had no desire to drink, which was really interesting to me.
And you'd think I would have noticed that. But okay.
100%. So like one glass of wine would be like, ooh.
Didn't even want it.
No.
Did it taste good or it just didn't appeal?
It was just, it was meh.
Meh.
It just was meh.
Right.
And so from that perspective, I was like, wow, I kind of like that. I like that side effect of what I was not expecting. And so anyway, I was on it. I lost more than 14 pounds. I ended up losing 20. And
Okay,
which I
wow.
wasn't planning.
Uh-huh.
It just happened. And then I was like, whoa, okay, I need to. So I stopped.
Okay.
Because
so
I
how
felt
many
like
months were you on the semaglutide?
I want to say it was 6, maybe 7 months.
6 or okay.
Yeah.
Okay.
Yeah.
And so, I mean, that is a pretty good cadence, right? And so I'm curious though. So you lost more than you were
Yeah.
thinking you're planning on. Do you feel like you lost muscle?
I think I
You
did.
probably did. And so did you, when you went to the guy, did they talk to you about maintaining your protein intake and stuff like
Gosh,
that and diet? Like what
no.
kind of management did they offer at that place?
I bet if I would have asked the questions, they would have provided the information, but
Uh-huh.
it wasn't like it was basically went in for a month. They gave me the product and had me draw it and every week for a
So
month, right?
they taught you how to
They
draw
taught me how
that.
to draw it and
Okay.
make sure, whatever sterile as you can be as
Yeah.
as an
Well, it
individual
should
who's
be drawn up sterilely for
right,
sure.
right. And so
Anything you're injecting inside your body. Yeah.
so they wanted to make sure that I could
That
do
you can,
that, right? So but it
yeah.
was really, really like a 5-minute appointment. And so I didn't
Okay.
really ask those questions. I'd be like, "Oh, I'm feeling a little nauseous," you know, or I'm constipated and, so but they didn't talk about protein and they didn't
Okay.
talk about muscle loss.
Okay. It's kind of interesting. So, I mean, obviously, since that time,
Right.
I've developed a program in my place,
Mhm.
and we have that initial consultation is like 45 minutes just to talk all about it, right?
Mhm.
And then for the first month, we have 15-minute appointments to answer any questions, and then it's once a month we have them come in for the 15-minute appointment and answer any questions at that time. But the big thing that we've stressed is because if your appetite goes down so that you're really a small amount of food is satisfying, you're just
Right.
not hungry anymore, then you cannot eat a donut, right? Like you can't eat a donut because you'll be full on that donut and you won't have had any nutrition. So it's like super important, like number one, to make sure people get enough protein because otherwise you're going to have muscle wasting. And there's nothing worse than like killing your muscle instead of your fat. That's terrible.
Yeah.
So for people at home, like your average 150-pound person needs at least 60 grams of protein a day just to barely maintain their muscle, right?
Right.
Probably should get more than that. But for me, I've been like, okay, 60 minimum. And so you have to tell people that. Otherwise, yeah, because, when you eat whatever and then you're full and then you're
Right.
not maintaining. So, but anyway, so you did that.
Mhm.
So what happened? You went off of it for a while?
Well, I had lost
You
a lot
lost more than you needed
more
to.
than I
Okay.
needed. And I was like, okay, well, let's just, this is my new baseline and let's see
Hmm.
where it goes. I mean, I had a few pounds to go to get to what my goal weight was, like, I mean, in the deficit, so I could gain weight.
Hmm.
And I wanted to see would the hunger pangs come back? Would I
Hmm.
overeat? Would I start drinking more than what I should, etc.?
Right.
And, of course I did, but not excessive amounts, of course. But I think my body went back up for sure. So I gained some weight, not a lot. Again,
A few
it
pounds
was just
back
a few
towards
pounds.
your baseline.
Yeah.
And what was it? How did did the hunger completely come back the way it was before? Or was it,
Oh, yeah.
it
Oh,
totally did.
yeah.
Okay.
Oh,
And
yeah.
alcohol too?
Oh, yeah.
Yeah. So everything just kind of reversed the
Oh,
moment.
yeah.
Yeah.
Like
Okay.
100%. And then that got me to think, well, okay, what about maintenance? So
Hmm.
clearly I'm in this space where, well, I mean, I don't wanna gain the 14 to 20 pounds again, right? I
Yeah,
mean,
for sure.
so what does maintenance look like? And I think that was where when you and I
Yeah,
started
we started
talking
talking about this.
about it, and you were like, "Boy, you've really lost a lot of weight." And I was like, "Yeah, I lost a little bit more than what I wanted to, but this is why." And
Right,
you were
right.
like, "You didn't tell me."
Just like so. I was like, of all the people
I
and not tell. Okay. It's okay. It's all right. I forgive you. So that was when we were starting our program. And
Right,
so it was like, oh, well, maybe I'll do maintenance with
right.
you
Mhm.
guys. And so now you've been doing maintenance with Tirzepatide,
Uh-huh.
right? So tell everybody your experience on that and just how it's different.
Right. You know, it is a far more sort of softer entry into weight loss. It doesn't feel, I don't have nausea. I don't have like almost visceral reaction towards food. Like, oh, I really don't want to eat that. It doesn't appeal to me the way that the
Mm,
semaglutide did.
okay.
The other part though is the drinking, there's no off button. I mean, I have my own off button, but when with the semaglutide, you have an off button. What
Meaning
I
it just
felt.
makes it so you just don't
You
want the
just don't
alcohol,
want
whereas
it.
on tirzepatide, you feel
I
like
do.
there's nothing
Uh-uh.
about it that's unappealing.
Exactly.
Yeah, yeah.
I mean,
What
yeah,
about just feeling full? If you're feeling full, would you still have a drink or
usually not.
no? Because 'Cause you're
Yeah,
full and it's like there is that satisfaction thing where you're not,
it
like,
is.
still consuming.
It
Okay.
feels it feels a little more natural,
Uh-huh.
right?
Yeah.
It just does.
Yeah, and so just for everybody at home, like, the doses of these drugs are different, so they're measured so a typical starting dose for semaglutide is 0.25 milligrams, whereas a typical starting dose for tirzepatide is 10 times that, is 2.5. And the doses aren't exactly comparable, but what Felicia's experience is what we see in all the studies, and that is that semaglutide just has more side effects. So there's more constipation, more nausea,
Mhm.
vomiting, stuff like that, reflux, and just a queasy feeling, especially the first day. People describe the first day. And then after the first day, people say it's not that bad. Whereas with tirzepatide, we've now had this for a while now. And we really haven't seen nausea at all. We a little bit of constipation, a little bit of reflux.
Mhm.
We've actually had two, that I know of, at least 2 people have episodes of diarrhea, not, like, all the time, but, like, as they were loading on, increasing their doses, 1 or 2 episodes,
Hmm.
but then, that has gone away and it hasn't recurred, but it's kinda interesting. And also just from my own experience, so I haven't done semaglutide. I find the whole alcohol part really interesting.
Right.
For on tirzepatide, for me, I had 0 side effects, but also I did not experience that alcohol thing. Like for me, alcohol was still just as appealing. Although for me, I felt like sated is sated for both food and alcohol. So you're
Exactly.
full, you're like, yeah, I'm done. I'm not. And so I've had way less desire to drink on tirzepatide, and that's been super interesting. The other thing that we've seen with, with other patients is quitting other things, smoking
Hmm.
and drugs. And I find that really, really interesting. There's something about it that makes you feel just satisfied more than just with hunger,
Right.
right? You're not craving
Well,
whatever.
I will note that I did dry January
Mhm.
and I didn't miss it, and I still haven't had a drink.
Oh,
So
that's
where are we?
interesting.
We're in
Yeah,
mid-Feb.
we're halfway through
So,
February right
yeah,
now.
and well, which it then made me realize, well, boy, you were really using alcohol as a crutch. I mean, so it allowed me to reevaluate my relationship, right,
Uh-huh.
with health.
Interesting.
Yeah.
Yeah.
So
So, but you were just to clarify,
yes,
you've been on maintenance tirzepatide during
yes,
that time? Yeah?
exactly. Mhm.
Okay.
Which I think
And
it helped.
is that looking like every 3 weeks for you, or what is
Yeah,
that turning out
yeah,
to be?
every 3 weeks.
Okay.
Uh-huh.
Because I'm in my like, I lost, like, 22 pounds total, and then I just stopped, like, a little more than a month ago, probably 5 weeks ago, and I haven't had a dose since then.
Wow.
And I've not really gained any weight back.
Mhm.
I definitely feel the hunger for sure. The desire for alcohol for me is way down, even though, like, I still like it, but I don't know. It's kind of interesting. I don't know. I'm not sure I can really explain it just from one mechanism. I think it's kind of a combination of mechanisms because once you're not drinking that much in general,
Mm-hmm.
then you're out of the habit too.
Right.
So you're not like just having it while you're cooking dinner or having it at dinner. So
Well,
yeah.
yeah, and then I mean, well, and are you an addict or not? Like, I don't think I'm an
Well,
addict, but I think it was a habit for sure.
for sure. I
Yeah.
think it definitely was a habit for me too. I don't think that, yeah. So I think that that's really interesting. I don't know what maintenance is going to look like for me. So I lost all of that weight on the lowest dose. It's like an intro dose of Tirzepatide 2.5 is considered like a loading dose, and it's actually not considered therapeutic.
Hmm.
And as far as I know, we haven't had a patient yet who lost a lot of weight on that low dose other than me.
Hmm.
So most people are on 7.5 and we have a few people on 10 for Tirzepatide. And so generally what maintenance looks like for people on average, I think it looks like about every 3rd week. So whatever that dose was for you, the weight loss dose, it's going to be one dose every 3rd week. So, which is good because this stuff is expensive.
Right.
And as I've covered on a couple other podcasts, but most recently, the one from a few weeks ago that was entitled Tirzepatide in Chaos, right? So there's a lot going on because the FDA took for Tirzepatide, but not semaglutide. So semaglutide is still available in compounding pharmacies, but Tirzepatide is, as of this month, for 503As and next month for 503B pharmacies,
Mhm.
will no longer be available in a compounded form. Now, there's a ton of ways around this apparently, and I did find it really interesting that these big ads were going during the Super Bowl because they were both advertising essentially, well, one of them specifically mentions Tirzepatide.
Mhm.
The other one doesn't specifically mention which drug they're using, but it's really interesting to see them advertise to millions and millions of people about these
It
programs.
just says how much money is really behind all of this,
Well,
right?
yeah,
My
yeah.
gosh.
But I think, I mean, just to get back to, using this for weight loss. So the other really interesting thing is Eli Lilly is the company that makes Tirzepatide. Okay. Different company, Novo Nordisk, makes Ozempic and semaglutide. But so Eli Lilly came out with a press statement not that long ago, a couple weeks ago, that said, we do not believe people should be using this drug for non-FDA approved uses. So the FDA has approved these drugs for diabetes and obesity, but not for just weight loss, like for people like you and me.
Mhm. Of
Okay. Then a few weeks later, they issued their own direct sales website for patients. It's
course.
very expensive,
Uh-huh.
but they're willing to now sell it directly to patients.
Mhm.
And they now, as far as I know, are partnering with at least one online provider because that's what one of the ads was during the Super Bowl. And I think they're like, oh, wow, we've got this giant cash cow. We're going to make as much money as possible and sell it for weight loss, even though they just said they
Of
don't want to
course.
do that. So I don't object to that exactly because I mean, the price gouging, yes, but I think it's a phenomenal drug for this.
Mhm.
And my own experience, I am now like I've always been super active. I've always worked out. I've always done active things like biking and skiing and stuff. But I have had now a couple injections in my back because of back pain. My back pain's gone. I
Yeah.
am stronger than I've ever been. I can do pull-ups now, which I
That's
haven't been able to do
amazing.
since I was,
Yeah.
had
Yeah.
gained the weight. And then for people who are diabetic and people who are obese, I think it's going to roll back diabetes. I think it's going to roll back pre-diabetes. I think
Mhm.
that people, what happens when you gain so much weight that you can't move that much anymore is that that becomes a vicious cycle and you
Mhm.
just get larger and larger because you can barely move.
Right.
This is going to help people get smaller so they can move
Mhm.
and they can just be more healthy. So I actually think these drugs are amazing. I'm actually looking forward. There are many more in development right now.
Right.
So we don't know when that's going to happen. I think my guess, I don't know this, so, don't hold me to this, but my guess is the next one will probably come out in this calendar year.
Mhm.
Hope, anyway.
Yeah.
And I think that it's really gonna change the health of the nation, right?
Hopes.
But the big thing, I definitely think the problem here is that there's not enough counseling, there's not enough medical advice or medical management. So one, to make sure people get proper nutrition, because it really is true. Like if your appetite is down to just sort of life and activity sustaining appetite, then you absolutely have to eat nutritious foods.
Yeah.
And hopefully our audience won't like beat me up over this, but most of what Americans eat, I don't even think of as actual food, like so all the prepackaged stuff that's like
Right.
what big food companies want you to eat
Yeah.
in order to sell it to you. So, but you really need protein and vegetables and
Right.
fruit. And so you just have to keep in mind if you are going to do one of these drugs, you have to eat nutrition first. And if you are actually still hungry enough to eat dessert, good for you. You probably won't be. You will not have the kind of appetite where you can even tolerate dessert because you're just going to be full and you're not going to want it. So I think that it's just kind of amazing. I mean, I personally plan to keep this off as long as I have access to the drug. I mean, I'm doing pretty well on my own, but I think that yeah, over time I'm just going to gain it back the way I have in the past. I do think that we gain weight more slowly than we lose weight. Like, right. So, you go on a big diet, and then it might take a few years to gain all that back. Right. So my hope is that with maintenance, we'll be able to keep it off and stay active, well into our 80s, 90s, and
100%
right?
agree. Yeah.
Yeah.
Yeah. Yeah. The
So
healthier I am, the better. I mean, my life is just so much. I mean, I'm just a happier
I
person.
know, me too. Yeah.
Right. So,
Yeah.
yeah.
Well, it's nice to have a best friend who's really happy. So that works for me. Is there anything else you want to share about your journey? Any advice for our listeners about?
Oh, wow. Yeah. I mean, I think it's just really important to normalize this. And I mean, I think a year from now, we're not even going to be, this is, nobody's going to be talking about this. It's going to be, everybody's going to be.
Everybody's already going to be on these drugs.
I mean, yeah. I mean,
They are still very expensive, though. I don't
yeah.
think that it's super accessible. Semaglutide actually is coming down, but Tirzepatide, I mean, the price is going to skyrocket as of like next
Right.
month because it's just not going to be accessible. But I think that it's really important to make sure that people don't shame anybody for using these drugs
100%.
because you know what? Like I'm a really disciplined person. I have a lot of willpower.
Me too.
I can't, I mean, it's
Uh-huh.
hard,
It's
man.
really
I mean,
hard.
and it gets so much harder in your 50s or post-menopause. It's
Yeah.
like, holy crap, what am I going to do?
Yeah.
I used to be able to diet and exercise my way back down, and I just haven't been able to do that. And I just turned 57, and I think there's absolutely no shame in this. And I also, saying that it's for the celebrities, like there was the Grammys recently, right? And everybody was like, "Oh, look at all the celebrities; they're all skinny." And hopefully we'll make this so that it's not about privilege and it's really just about health.
Yeah. We have bigger issues in this country.
We do. There's a lot
Yeah.
there's a lot going on, but we can all hopefully have a healthier and happier year.
I think what's really important is continuing to exercise and lift heavy,
Yeah.
right?
Yes. Lift heavy objects for sure.
Because I mean, even though I do, I lift, I still have some muscle loss just
Mm,
because of
yeah.
I think menopause, right? I mean, I've noticed it I haven't changed my workouts like and I haven't gone backwards. If anything, I've added.
To
So
your workouts.
to my workouts, yeah.
Yeah.
And so I would say, it's really important to lift. It's really important to prioritize nutrition and protein.
Hmm.
I try to get my grams of protein in my weight, so I translate, which is really hard to do in a day. I mean, I know that you were talking about what were you talking about? 60 grams
Minimum of
minimum.
60.
Yeah.
Yeah.
I try to get, I mean, I try to get my weight
Oh, wow.
in a
Yeah.
day.
Yeah.
And it's really hard to do,
That's
but
hard to do 'cause
it's
that's
hard
a
to
lot
do.
of protein.
So I supplement like
Yeah.
with protein powder and
Yeah.
if my dessert is usually protein forward, cottage cheese or Greek yogurt or something like that.
Oh, well, then you're
if I
not
want
lactose intolerant the way I am,
it.
because I
No.
cannot even look at cottage cheese. Do you have a protein powder what do you do with your protein powder, and what kind do you use?
Well, I mean, I get the cleanest one that I really like the Fairlife, which is not the powder.
Okay, I don't
It's
know
the
that one.
Fairlife
Fair.
is, I think
Oh,
Coca-Cola
Fairlight.
is trying to acquire it.
Oh, really?
It's
Okay.
really delicious, and I get protein powder from whey protein powder from Costco usually.
Oh, yeah.
Try to get the best price. And I'll do a collagen that's got protein in it. Might put that in my coffee in the morning. Yeah, so I usually just get it at Costco.
Yeah, and the reason collagen is a decent protein source is because it really is flavorless, so
Mhm.
you can put it in coffee and it doesn't make it taste funny. Collagen, I think I've said this on the podcast before, it has all the amino acids, good for you, but it gets broken down
Differently?
into well, no, just like any other protein, it gets broken down into amino acids and
Okay.
little peptide chains and
Mhm.
absorbed by your body. There's nothing about collagen eating it that where you can eat it and have it, like, go into your
Oh,
joints or your
gotcha.
skin
Yeah,
as
yeah, yeah.
collagen, right? It's just another source of protein. But it is really the only one that I know of, and maybe if anybody knows one at home, wants to tell me about it, but it's the only one that I know of that really truly has no flavor, so you can put it in things and it doesn't make things taste weird. Like, the one I like, I don't like the whey ones because I don't like to have milk, but so I usually use a pea protein one. There's
Mm.
several different ones, but the Vega Sport has one that's vanilla that tastes like it just it's a mild vanilla and it's good in smoothies. That's the one I like. But there are so many. But anything but yeah, ideally you have at least 20 grams of protein in your smoothie.
Mhm.
I upped it to 30 when I started on Tirzepatide because I was like, "Oh my gosh, I really need to consume enough protein," and I just wasn't that hungry, so I needed to
Right.
get it somewhere. Yeah.
Yeah.
So, well, I think that's really great advice. I really appreciate your coming and sharing your experience, and we will be back for sure as soon as I have an update on what's happening to the Tirzepatide program because, basically everybody's scrambling around right now trying to figure out how to get it, how to offer it, how to continue offering
Right.
it. And I think that there are some reasonable solutions out there, but basically it's going to depend on getting real brand name Tirzepatide because you really won't be able to legally get the compounded stuff anymore.
Get it from Canada?
Well, so individual patients, just so you know at home, individual patients can actually, if they have a prescription, they can have it filled in Canada and go get it filled, right? It's not legal for a provider like me to import it from Canada and
Oh,
and sell it to
but
you or
individually
prepare
I
it for
can.
you. But
Yeah.
individually, yes, and that was one of the solutions we've looked at actually.
Oh.
But it's complicated. It's like it's really hard. And one other thing about these programs that are online is that they are not generally offering a lot of help. They're not offering medical advice or medical management. And this is a real drug. There's real stuff that can go wrong. So, my personal feeling about that is that you should get it from somebody who can actually help you if you have a complication. And, that's one thing that's been really important for me in my office is being able to make sure we're there medically managing these people. Because if you're going to the ER with nausea and vomiting from semaglutide, then something's gone terribly wrong.
Right.
And I had an ER doc on the podcast earlier this year who said that that was probably the most common complication from med spas she saw,
No
where
way.
people who are kind of get going up, they've been up on too high a dose of semaglutide and they came into the ER with nausea and vomiting that was uncontrolled.
Wow.
Yeah, so you just kinda have to be careful. Just, you do kinda get what you pay for, so hopefully you're going somewhere where they can actually help you,
Yeah, that's good
manage
advice.
it. Yeah. Honestly, tirzepatide's much easier because
Yeah.
there's fewer side effects, but now that's gonna be harder to get. Anyway, I hope you've enjoyed this conversation. Thank
Thanks,
you so much, Felicia,
Kate.
for coming
Thank
today.
you.
All right. And for now, this is Dr. Kate D with a little bit more of Med Spa Mayhem. If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website medspamayhem.com. And read the book. Med Spa Mayhem is available everywhere books are sold. Thanks for listening. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. Med Spa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.